Hello, I'm Dr. Ross Walker and welcome to the checkup. Hello, Dr. Ross Walker and welcome to the checkup. Last week we spoke about how chronic inflammation was an important component of heart disease. Now I'd like to bring in the whole cancer discussion. Now, let me say my best cancer tip I can give you is to use the organ for what it was designed for. So I'll give you a couple examples there, then I'll bring in and explain how chronic inflammation fits in here. The best example of using the organ for what it was designed for is we have a couple of things in our chest called our lungs. This is going to shock you, but they were strangely designed for a thing called breathing, not to put a white stick in your mouth and suck the smoke in. And you wonder why you get cancer. So when you smoke a cigarette, you're taking in at least 50 poisons into your lungs and then spilling into the rest of the body. And those poisons shouldn't be there. And the body then has to mount an immune response to try and get rid of the toxins. But that immune response then damages the immune system and it sets up abnormal cells in your lung, in the linings of your lung, sometimes the lining of your bladder, the upper gastrointestinal tract, your mouth, your lip, and markedly increases your risk for cancer. Equally, looking at, say, breast cancer. What causes breast cancer? Well, again, our bodies were designed to be hunter-gatherers. Now, whether you like this or not, this is called evolutionary biology. And the reality is, what happened to young girls? They would go through their periods in hunter-gatherer days, maybe age 10 to 13, and within a year or so, they were pregnant and they breastfed. And what's happening now, little girls are still having their periods from about 10 to 13, but then they mightn't have a baby for 10, 15, 20, sometimes 30 years, sometimes not at all. And interestingly, the longer time between the onset of periods and you starting to breastfeed, the higher the risk of breast cancer. I'm not saying it's all about breastfeeding, but that's one of the reasons why you should be using the organ for what it was designed for. The breast was designed to feed children, and if you don't feed children as quickly after you have your periods, there's a higher risk of breast cancer, which is why physiologic, and again, I don't want to get into the sociologic discussion or arguments or anything else to do with this. I'm just giving you pure physiologic facts. If you don't like them, switch off the checkup. But the physiologic time to have a child is between 15 to 25. That's the best time. Obviously, in our modern society, that's not socially acceptable. So that's breast cancer. Prostate cancer, and here's something that some women would want to hear, some women don't want to hear this, but men who regularly empty their prostate with sexual activity have lower rates of prostate cancer. So there are three good examples of using the organ for what it was designed for. But when you look at any common cancers, there is a link between not using the organ for what it was designed for and cancer. And with that, all these toxins are created, which then sets in the immune system in to try and get rid of the toxins, and that alters the cells, and the cells can then become cancerous. That's the checkup. We'll talk to you next week.